Joining us today at GetMirrored is Dr. Seemab Shaikh, who is a renowned ENT surgeon across India and the international world of ENT, very much based in our very own Pune camp area. He is celebrated for his pioneering work in snoring and sleep apnea treatment. As the founder president of the Indian Association of Surgeons for Sleep Apnea, he has spearheaded awareness and treatment initiatives across India. Dr. Shaikh was also instrumental in developing the Indian guidelines for obstructive sleep apnea, a key reference for professionals in the field. With over 20 years of experience as a sought-after guest faculty at workshops and conferences, he has made massive contributions both nationally and internationally. His contributions in the field of ENT are not just restricted to the field of snoring and sleep apnea, but he is known to be a very reputed ENT surgeon in the fields of sinus diseases, deafness issues, and nasal allergies too. So let's welcome Dr. Seemab Shaikh. Dr. Seemab Shaikh, thank you so much for joining us today at GetMirrored. So let's start with sleep. How many hours do you think we should ideally be sleeping? And should a person be sleeping 7 to 8 hours?
So at the outset, thank you, Aiman, for having me here. Thank you, Pune Mirror, for getting me on board. And it's always a pleasure. I've been reading the paper for many years now. And it brings out fantastic city-related points with regards to social justice, infrastructure, health, and just seems to be getting better and better by the day. So I congratulate you all for this kind of... So you're asking me how many hours do you sleep a night? Should you sleep? So ideally, you should have about 8 to 9 hours of sleep, preferably always at a stretch, continuous. So break in sleep is as bad as any disorder of sleep. You need to sleep at a stretch.
And is an afternoon nap very important as well?
Yes, of course. But that does, it's not like you can compensate the deficit by an afternoon nap. The afternoon nap is like a power nap. It is there. So you have to understand one simple thing. We have a cycle of sleep, which is like about an hour and a half each, where you go through 4 stages. So you have to actually go down to the 4th stage and come up to finish that one cycle. And you're ideally supposed to have at least 6 cycles through the night. And that's the reason why that entire sleep becomes... So for example, if I was to just give you a small little simple example, that if you have an early morning flight or any early morning thing to catch, and you wake up with the alarm, that alarm breaks that cycle of yours. So one of the cycles is broken. And then that doesn't complete your entire sleep cycle. And that's why you get up groggy, not so fresh. So you must have a continuous sleep pattern, always.
Another question is about snoring. Now, why is snoring such a big cause of concern today?
Yeah, well, it is. It's actually become a very big cause of concern. So, what we need to understand is, you have to look at snoring in 2 ways. One is your social impact because of snoring, and one is the health impact, the medical impact. So most people today actually turn across and they come across for the social impacts of snoring, because you have problems sleeping with your bed partners, you have problems, people who are in the marketing field cannot share rooms with other people. So these kind of creates a big issue, and when you're traveling on flights, everybody is disturbed. So these are like the social impacts. That's why people are actually looking at it. What people really need to realize is the health impacts of snoring. So snoring basically would indicate that somewhere in your air passage you have a blockage. That's the only reason why there's going to be a fluttering sound, right? And that blockage is causing a lot of drop in oxygen supply every time you're breathing. And that drop in oxygen supply consequently is responsible for all the entire consequences of a disease called obstructive sleep apnea. So snoring is basically just your body's way of telling you that, okay, somewhere in your air pipe there is a blockage, and then there are consequences and subsequent issues with snoring. That's why snoring today has become so important to the medical world, and mostly people approach for the social reason. So then they have to be explained that, okay, this is one part of it, this is where the actual problem lies.
So what one generally hears is, oh, he's very tired and hence he's snoring. So doctor, could you just throw some light on the myths and the facts surrounding?
Yeah, so these are exactly the myths. A lot of patients come across and they tell, oh, my grandfather used to snore, my father used to snore, my uncle snores, what's the big deal? So back then, awareness was not so probably good. Now the research into the issues with sleep apnea, the consequences of untreated sleep apnea, we are worried. This is what is a major silent killer And you'll be surprised at how common it is, because people think that everybody in the family has snorers, so it's not a big deal. It's not. They think it's hereditary also, but it's not. So a recent study done at the All India Institute of Medical Sciences out of Bhopal has come out with very, very shocking facts. And it's a very, very evidence-based study which shows that the incidence of sleep apnea in India, we had global incidences anyways, but in India now we've come to the understanding that it's about 34% and above. 34% and above.
That's right.
Extrapolate that, and you're talking about one person amongst every three people. And in a family of 3 or 4, there is a snorer in every family. And that's why people tend to think it's common. It's not something to be so worried about, which is not the case. So those myths really need to be busted, that don't take snoring lightly. There are consequences of not looking into it. And that's what you need to really go ahead and find.
So does sleep deprivation also lead to snoring? Is that one of the facts?
No, it's the other way around actually. Snoring would cause sleep deprivation because it's not only deprivation to the patient but also to the partner. So that causes all the other neurocognitive issues that come in. So one of the two major complications of untreated sleep apnea are related to the brain and the heart. Right? Out of that, the heart is a stronger muscle, so it takes a little more time to weaken. But imagine your brain not getting a required oxygen supply night after night after night for many times. So all those neurocognitive is what we call. They're basically related to small things which people don't give importance to. Loss of memory, recent memories, irritability, most important. Imagine what happens to you if you have not slept for enough sleep. So that irritability, lack of memory, short-term memory lapses, inability to concentrate at work, especially more for the people who have to constantly be on screen and look around. So you have to be able to pick up these signs at the earlier part. So the neural part comes out faster, then go in the later ones. Of course, it affects every system in the body, but we as medical people or specialists dealing with sleep disorders would be very worried about the neural and the cardiac related issues. That can get very dangerous. I don't mean to kind of alarm the viewership that is there, but it's more out of awareness that they need to understand to pick up these points so that they know they could be headed towards something.
So doctor, what's the relationship between snoring and sleep apnea? Is it one and the same or?
Not really. It's almost synonymous in a way because snoring is just one of the symptoms of sleep apnea. The disease obstructive sleep apnea would come across with a lot of symptoms. Like I said, it could be the early morning not being fresh, and that is the most characteristic sign. So you may have slept for 14 hours, but if you are not fresh in the morning, that means somewhere there's a problem. So snoring is just one out of these symptoms. So you can have snoring with sleep apnea. Does not necessarily mean that all snorers will have sleep apnea. So you need to diagnose that. You need to assess that. And then only you can go forward with the treatment, because the treatment for simple snoring is very different from treatment of snoring with sleep apnea. So like I said to you earlier, snoring is just one way of your body telling you that there is a problem, please look into it.
And as you said, that it definitely affects relationships and the overall.
Oh yes, you will be surprised at the number of marriage counselors who are now aware, actually sending back patients to me to have an assessment because of the snoring issues, because it does affect interpersonal relationships. It affects your productivity. The world is waking up to it also for the same reason. Western countries see the loss of productivity in these things, and that's why it's very important. It affects relationships of every kind, work and personal.
Do young children also have sleep apnea?
Yes, young children are also known to have sleep apnea, but in fact they are the easiest to treat. It's more complex to treat in an adult, whereas in children the matter is quite simple to diagnose and treat.
But
and in fact,
as how much?
No, as young as even a 1.5, 2-year-old. Yeah, and in fact, in our circles of the medicine where we are talking about sleep disorders, we have a very straightforward dictum. You catch them young so that you can treat them very well, because they are very, very easily treatable. Not to say that the adults are not, but it is much, much easy to treat a pediatric sleep apnea so that he doesn't transform into an adult sleep apnea. So you've got to hit them young if you're able to catch them.
Is there any correlation, doctor, between dreaming and sleeping?
Yes, of course. So dreams. So when I mentioned to you about the 4 stages of sleep, the fourth stage, the REM sleep, is where the dreams actually happen. So having your dreams is a good sign. It means you have reached down to that level of sleep and then come up again. Right?
So it's good to dream.
It is definitely not in the day. Don't daydream. Get yourself to do things. But yes, in the night, dreams are they're a good sign. They're a good sign. A good sign.
Do all these today? We get all these sleeping apps which on the mobiles and watches. Does that really help? Does this really identify sleep apnea?
Yeah, so I get a lot of patients with this data nowadays. And everybody is very tech savvy, so they approach and they just lay down the data in front of you and they show. So by all means, these apps and these new devices definitely have a role to play. But the thing is, even a common man has to understand that based on these apps, I cannot take a scientific decision. We will need more investigation. So these apps, what they do is they kind of give you your patterns of sleeping, your patterns of disturbance, 10 days, 15 days, which positions you've had problem in, which positions are better. So definitely there is valuable information coming out of that. They talk about oxygen fall and everything. They talk about breathing issues. So there is valuable information coming out of the apps. I won't write them off. But we can't really base our complete scientific decisions based on just apps. You still need to do your sleep studies, you need to do your polysomnographies, you need to do an investigation to confirm.
So, doctor, do these nasal sprays and eye masks and eye pads really help? Does that improve sleep?
So the iPads and eye masks to a certain extent, because it gives you that darkness to be able to. Nasal sprays are to be used with very judiciously for the required indications. You can't just go across the counter and pick up some stuff and start using it, because all of them will have side effects also, if at all. And more importantly, if that is not a problem, they're not going to help. So there is a lot of marketing that happens with these kind of things, but a person has to understand that any medicated say spray or tablet or drop has certain indications. You can't just use them randomly across the counter. If you have allergies, yes, they are necessary. If you got some nasal blockages, yes, they come into handy. But you just can't go ahead and use it and think that my snoring is going to go away.
Doctor, you did say that it's treatable, and the younger you catch them, the treatment gets easier. So could you throw some light on what are the treatments you'll generally adopt for sleep apnea and snoring?
So, pediatric OSA is a completely different ballgame. It's very simple. Adult OSA, like I said, is the complex one. And a lot of things depend on actually what you find out of your investigation. So, when we talk about obstructive sleep apnea, it's an obstruction for some reason or the other. It could be just a small, simple tissue swelling, or it could be a proper block. So, based on where is the block, how severe is the block, and also based on are these blocks actually causing the drop in oxygen, which is significantly dangerous to the body. So the decision making depends on all this. There are a variety of treatments available. It is definitely treatable. See, the science has gone way ahead to another level. And that's the reason we have such huge meetings, we have discussions, we have interaction of scientific data, across continents, because we are now reaching a stage where we are treating this evidence-based and scientifically. There was a time when one would say that, oh, this works in my hand, this works. No, now we're talking more evidence-based. So all the treatment decisions are complex. Treatments are simple. I think that's one message for anybody who's watching and gets worried about, treating sleep apnea.
Surgery, I'm sure, is one of the methods.
Surgery is one of the methods.
And generally, people are scared of surgery, yes. And
that is the normal phenomena that's there. That's the normal thing for all patients. So if that is one way, and via your medium, if we can break that myth, it is very important for people to realize that surgery is just one of the ways. It's not the only way, right? There is a role for everything. So, like I said, the decision making is quite complex. That's where the in-depth knowledge and understanding is very important. So you can have things that may be needed to open up the airway. You can have, devices which try to pull your tongue outside. You have other devices which work like, pushing in oxygen forcibly into your system. There is surgery. Even in surgery, a lot of things have changed. Everything is now evidence-based. Tools and technology has, made things so beautiful now.
So one of the things we keep hearing, doctor, is that you need to do a sleep study.
Yes.
Could you throw some light as to what is sleep study? What is a CPAP? Because these are terms, we generally tend to hear.
So CPAP, like I mentioned to you, is a device which blows in oxygen into your system, but it has a huge mass to be used. And it is definitely indicated as one of the very most common, or rather most commonly used treatments in the earlier parts. Now with multi-disciplines coming into the picture, then there are roles for other disciplines also. So CPAP is just a device which actually pushes in oxygen into your system when you're not able to sleep. So it's like a ventilator in the ICU. When the patient is unconscious, it's giving the oxygen. So this is a device which is a kind of ventilator is not exactly the right word, but it kind of pushes in oxygen, which does not require an oxygen cylinder, by the way, another myth. So it just takes in the atmospheric oxygen and pushes it in.
And you have to use it every night?
Yes, you have to use it every night.
And that prevents snoring.
That would by default prevent snoring because it's keeping that obstruction open. So by default, the snoring would go away. But it may not be as simple as it sounds. So see, sleep study is the easiest way to diagnose sleep apnea. Right, so there are two ways to do it. One, you could do it in the hospital with a lot of leads all across you, because that checks your brain signals, your eye signals, your muscle signals, and everything. Sometimes it's a little cumbersome for patients to move into a hospital and then do that. Of course, that is one of the most ideal ways to do it. But across the globe, and especially in our country also, what we are popularizing is a home-based kind of a situation where it's a screening. Right? So a sleep study is a screening, the initial level 3 as we call it. I won't get into technical details, but the level 1 which I told you is the best way to do it. But we tend to do screening by a sleep study device, whereby you just have very simple 2 belts, one belt on your chest, one belt on your abdomen. Everybody knows about the pulse oximeter because of COVID. And you have a small cannula just under the nose which checks your airflow. So this is a simple battery operated device which you have to just put on at night in your own house, and it kind of records everything, and it's very mobile. You can actually go and get up to the washroom and things like that also if you need to. And that records your data of the sleep that you have had through the night.
So you need to use it the entire night.
Through the entire night. And obviously your sleep may not be imagine having something on you so you're not going. But that's kind of factored in when all the indices and everything is brought out when we take the sleep study. And that is, I think, a very important way, along with whatever devices and the apps that we have. If you supplement that with a sleep study, then you get a much more perfect diagnosis.
So, doctor, you've spoken to us in brief about all the treatments that are available. Could you also suggest any diet, exercises, all that, a lifestyle change is important too?
Very important. So that's the first thing that when we have, because overweight patients have a much more higher risk of sleep apnea, obstructive sleep apnea. It's a scientifically known fact. Obese patients definitely do. So one of the first things that we do talk to the patient about is lifestyle modification. But this has to go parallelly. The problem is when you start giving this as the only importance and miss out diagnosing and looking for other dangerous obstructions, if at all. But lifestyle modifications, I don't need to tell you that. You can even look up Mirror every day and there's so much of nutrition happening there. So a healthy lifestyle in general, of the right kind of food, the right amount of sleep, the right timings of sleep, all these things make a lot of difference to your sleep apnea. Because weight is going to compress, the fat tissue is going to compress a lot of your airway.
Does alcohol worsen the situation?
Oh, most definitely. So smoking definitely does have a role to play in your airway part, but alcohol is very bad. So most sleep apneics, we tell them to stay off because it's a very simple logic. See, what does alcohol do? It kind of just relaxes all your muscles. That's what it does. So the minute you're lying down in bed, your airway, which is already a very narrowed airway, is now collapsing even more. And that could be fatal at times. If you have a completely obstructed airway and the muscles are not having the tone to then wake up and start breathing, then that could be very bad. So alcohol in OSA A big no. Big no, or very cautious. Be very cautious if you're having your social drinks also.
But then I have read about deaths happening due to sleep apnea, even in non-alcoholics.
Yes.
Is that common too?
So, unfortunately, we don't have data to kind of support that how many deaths are related to sleep apnea per se, because most of the death certificates in our country are always death due to cardiac arrest secondary to respiratory failure. So that becomes an issue. But the so-called, I don't want to use very technical terms for the viewership to probably understand, but the way the disease is structured is that when your airway gets blocked at night, there is a certain limit of time to which the body can do without oxygen, including the heart. And if that blockage of oxygen lasts for a little bit longer than is needed, then it will eventually precipitate a heart attack. So you're eventually, when a person passes away, unless the heart stops, you don't pass. Right? Yeah. But there has to be a precipitating reason for that heart to have a heart attack. So this is a very common phenomena that happens. We tend to say that he passed away in his sleep and things like that, but something has to have precipitated that. Besides old age.
So, doctor, are there any new developments or research currently underway in the field of snoring and sleep apnea?
Aiman, you and Pune Mirror could probably do series and series on that particular thing. There is so much happening out there. In India. So India is no longer anywhere behind in the overseas. Trust me, I travel. I'm in touch with all the people across the globe also, and we are not far behind at all. Yeah, there are certain issues here and there that our FDA approval takes time and some things like that, but we have almost everything that the world has to treat sleep apnea. And the way things have moved forward, like I said, surgery has become very definitive. Surgery has become very sometimes non-invasive, if I may use the word. Surgery has become very easy to perform with the availability of the newer tools and technology that we have. Surgery has become very result oriented. So, there are definite. So we judge the pros and cons of every form of treatment. We weigh the benefits versus the risk of every form of treatment, and then we go ahead. And we do this scientifically, data-based, evidence-based. We don't just do it with a peer review of, say, 10 people saying this works or this doesn't work. So there's a lot that has happened. I mean, people today should not be even thinking about not getting good results in the treatment of sleep apnea and snoring. The results are good. The jury is out there. I mean, the results are there on the wall for everybody to see.
I think what happens, a lot of people in India especially don't realize that snoring could be a problem. Yes. There are lots of myths surrounding snoring, and I think this kind of a podcast and with your expertise and what you say, I'm sure is going to help our viewers a lot. I'm
really glad. I wish we can make that difference, because the myths need to be broken. Yeah. The myths definitely need to be broken, where people think that, you will be surprised at the number of people that I see who approach me, middle-aged couples, young couples today, who are actually sleeping in separate rooms. I think recently there was an article, I think I'm not recollecting where I saw that, but about sleep divorce.
Yes, that's a new term, sleep divorce.
And everybody is working, everybody's got to have their sleep, right? So you need to get this understood that snoring can be treatable so that you can lead your normal life.
So, doctor, what advice would you like to give our viewers as to the effective treatments are there for snoring? And what would your advice be for them?
My first advice to everybody would be, please be aware of this situation. Please be aware of this disease. Please don't get paranoid about. So we have this thing always where we tend to think that, okay, if I'm going to get myself tested and then something comes up and then this is going to get worse and that. Please understand that there is a, very good form of treatment available for this disorder. But you need to diagnose it scientifically, not just come for snoring, and understand the fact that it's not just about snoring, it's also about the sleep apnea. Diagnosis today is very simple. I just told you it's very easy to diagnose. It doesn't require any cumbersome tests, or it doesn't require you to be cut here and there or something happening here and there. The same is with the treatment. So if you understand where the problem is, you diagnose it correctly, the treatment is really good. But for that, the awareness becomes, the paranoia of getting worried about it should not happen. There's a huge difference and a very thin line between awareness and paranoia. And people need to bust those old myths about, okay, my grandfather used to smoke, this one is okay, it's not a big deal. Yeah. There is a major social and medical issue to it. Medical issue. Our insurance companies are waking up to it. It is now slowly we are working at those levels where the insurance companies are recognizing that this is not just a lifestyle related issue. There are specific problems which need to be corrected.
Correct me if I'm wrong, but I think after Bappi Lahiri passing away due to sleep apnea, has that created more awareness?
So there are quite a few. My profession does not allow me to take names, and I wouldn't do that. But yes, his was one certificate which was certified as dead due to sleep apnea. So were a lot of other people over the past couple of years, and it's the kind of work that we've been doing collectively across the country, where we are trying to make even the administration aware of how important this is, like it is abroad. So any person who is responsible for the lives of other people with him or her, be it a car driver, a pilot, an engine driver, a bus driver, they need to be really screened for these kind of things, because this is something which can be fatal to a lot of other people. So we need to have those situations in place where people are tested for these kind of things. And we're not talking about, so we're being very scientific. We're not going to test everybody randomly. Those who are screened, who are more at risk, should definitely go and get tested.
So, Dr. Seemab, this seems like such a vast topic that just one chat or podcast with you is certainly not enough. And I hope I can invite you again, and probably we could do a series on sleep apnea, snoring, which is certainly going to benefit our viewers.
Thank you. I mean, definitely, it would be my pleasure to come and try and do whatever I can, what I've been trying to do for the past 2 decades also. And if it makes a difference to everybody's or somebody's life, it's always worth it. I would love to be here again and have a chat with you.
I'll certainly invite you again. Thank you so much.
Thank you.
Thank you.
Thank you. Thank you, Pune Mirror.